love it. I'm glad.
Good evening and welcome to Inside Government, a show brought to you by Cayuga Community College and shown on Spectrum, Verizon, Fios, the college's radio station, as well as the Auburn Regional Media Access, ARMA, here at the college. Last fall, we had a discussion in the studio with our chief guest today, Kathleen Cuddy, the County Director of Public Health, about women's health, and specifically the new Healthy Mom, Healthy Baby project, Healthy Community campaign. And that has led to us having a discussion about doing a series of shows over the next couple of weeks and months on public health. We'll be talking about most likely smoking and vaping. We'll be, in about, I think, 2 weeks, we're going to do women, infants, and children.
Correct.
And then from there, we're going to also possibly do a session on lead, which I know there's a public campaign on that. But tonight we're going to talk about communicable diseases. The county has been is at the forefront of this fight, and we're talking about a whole series of things, from hepatitis A, which is now spreading across the nation, as well as the coronavirus, which we don't seem to be able to turn the television on without hearing about, as well as items such as HPV and the flu season. We'll talk about that. So we're delighted to have Ms. Cuddy back in, and she's joined by County Health Department Supervising Nurse Kevin Zippel. So welcome to the studio. Delighted to have you. You have a PhD, that's what we put up on the screen to identify you as. So let's talk about coronavirus right now, because it is impacting the markets. There is a lot of misinformation out there. So on a basic level, what is the coronavirus?
I love to speak and say that, I could answer all your specific questions, but as I mentioned to Kevin, I'm more of a generalist.
Okay.
We certainly have some, it's a new virus to our globe right now. But as Kevin will detail, they're calling it, the World Health Organization, Centers for Disease Control, they're labeling it coronavirus number 2 because there had been coronavirus previously. Kevin, do you want to speak a little more to that?
Sure. So there's a group of viruses that are related to each other, we call coronaviruses. And others in this group range from things like the common cold to MERS and SARS, some pretty serious infections you'll remember over the past couple decades. And this new novel coronavirus falls into that group. It's actually relatively closely related to the SARS. And it's not quite as lethal. It's more similar to the flu, but a little bit more lethal than that. And from the perspective of the United States, we're saying right now that it has high potential threat, but low imminent risk. The number of cases in the United States right now are very low. There's serious monitoring going on of the people who are coming in the country. Most are being kept in quarantine if they've come in with high risk, if they've come from China or had contact with somebody who does have this strain of coronavirus.
But what we're hearing about now is cruise ships. I think Venice in Milan have just closed down parts of some of their operations. We obviously know it's impacting the markets, and we don't even know what it's doing to places like North Korea because we don't have any information out of there. Right. So what is this a cyclical, is there a feeling that this is cyclical? Because I know the president spoke a couple of weeks ago, and he said, with warm weather, these types of things disappear. Is that normally the case? Is coronavirus a seasonal, or could this be a longer term item?
Some of these things like SARS and MERS kind of made one big splash, and maybe you'll see another little outbreak here and there, but for the most part, they were one and done. Others, like this common seasonal flu, every single year. And I don't know that it's so much a function of temperature as it is taking advantage of the fact that in colder weather, people are together in closer conditions, breathing the same air and touching the same things, which is how these are generally spread.
And so, to the best of your knowledge, we don't have any cases locally of this, correct?
Correct. There are no known cases in New York State. There have been some people who've been identified as having developed the virus within the United States, but no deaths, fortunately, within the United States. I would say that the quarantine and care and distancing, the common sense approach that people have with washing their hands, with keeping distance, staying home when you're sick, really does help with all diseases and preventing the spread of that.
So this is flu or anything else
Correct.
On that. So is it because we got ahead of it, because it was concentrated in a country that doesn't allow a lot of export? Forget financial export, but a lot of people don't leave China necessarily, compared to the free flow across the Mexican or Canadian borders. Did it kind of get contained there, and that's mostly the way? Has it spread as much?
There's no question that the controls that China has with their population.
Their political controls.
Yes.
Okay.
Yes.
Without getting political.
Yeah.
But they have
but
political
they are.
controls.
The government is a lot more involved in their lives, and restrictions apply to many people who live in China that don't apply to some of us who live in the United States, for example. And the population is much more dense. And in this case, I think with the coronavirus, the research is showing that it appears that some of the first cases came from markets where there was close contact between animals and people, and then if people live in close contact, they're more apt to spread things.
I think somebody was talking in the hallway here. Bats, I've heard
Correct.
that in the last. Do we know where it came from?
Bats are a common reservoir of viruses. You could say the same of cats and cattle and camels. We don't know for sure with this one, but certainly that has been shown to be the case with other similar viruses that travel from animal vectors into humans.
And are we sure, maybe you don't know this, just say you don't know this, are we sure, there's been also news stories that it may have come from a biological warehouse where they may have been prepping other things. Does it have the consistency or the factors that would come with a biological agent, a coronavirus?
I could not speak to that. I'm not familiar with that.
Okay.
I think there's always speculation with an unknown etiology of where diseases came from.
So how's it transmitted?
That's an excellent question, and I think that's something that's evolving day to day. We know that it can be transmitted like the other coronaviruses and relatives, that it's respiratory. If I have it and I'm coughing or sneezing, I'm going to be spreading it through droplets. There does seem to be evidence that it's also in the blood, so potentially it could be a blood-borne infection, although there's probably not a lot of opportunity for that sort of transmission in these cases. And like the hepatitis A we'll talk about later, it's been found viable virus in the feces of infected people, so it could potentially be spread similar to norovirus on cruise ships. You're familiar with that concept. You mentioned the cruise ship earlier. It does seem to be spreading on that, or was spreading on that ship faster than you would expect from airborne droplets.
So not to make everybody paranoid, what are the symptoms? What identifies this separate, let's say, from the flu?
I would say it's almost identical symptoms to the flu, with the potential that it could be, because it is classified in the same group as the severe acute respiratory, it has the potential to be more serious than the flu. But in terms of numbers of people that are affected, impacted, the flu far surpasses anything that we've seen with coronavirus, even on a worldwide scale at this point.
So where are we in flu season?
It's on us.
It is on us. So
There's lots of it.
there is. So do we know? I think you had sent me. You were wonderful to send me some statistics here, and I don't want to bog everybody, but down on this. But it does look like the flu vaccine has been successful to only a certain extent.
Correct.
About 50-50. Is that?
As with every year, it's not perfect. 50 is a good year. The numbers there
So are we
same
in a
as
good
around
year, or
45, around 45%.
Okay. Is it too late to get the flu shot?
No.
It is not. No, our medical director will tell you it's worth getting it through March. And the new flu vaccine is being anticipated based on what's going on the other side of the world, and they're trying to create. But it's not too late.
There's
and we
new cases
encourage
every
people,
day.
And it's influenza A and influenza B that we're seeing. The doctor's offices are full with people, and if you get it, because you're knocked
It's
down.
knocking you out. And the symptoms there for, so again, what are the symptoms of the flu if somebody's walking around and they're not thinking they have it, but they might?
Sure. So you're looking for the respiratory system symptoms, mostly coughing, not quite so much the runny nose as you would see with the common cold, but can be that as well.
So is it a hacking cough?
More hacking than productive, but usually with the high fever, and you don't see that so much with the common cold. And the symptoms are much more severe, and they last a lot longer than you would see with the common cold as well.
On an average year, do we know how many people in New York or upstate get the flu?
There are some statistics taken if you have a lab test done and it's sent to the lab, but a lot of offices will do in-office testing or may
Then
diagnose you
doesn't
based on
necessarily-
symptoms. So it's not as reflective as it could be to the number of cases that exist.
So not that I want to confuse the two. So if I get the flu, what is somebody going to prescribe to me?
Potentially an antiviral medication, something like Tamiflu. But for usually where we're seeing that is in cases of congregate living, like an adult living facility where one person is diagnosed with the flu, they would use the Tamiflu prophylactically to treat all the others.
Okay.
But for the most part, treatment for
Is a Z-Pak
flu.
in that category?
That's an antibiotic,
Okay.
so more targeted towards bacteria. Being that
Okay.
the flu is viral, really what we do is supportive care, make sure that people have enough fluids, that sort of thing.
And so how about for the coronavirus? What would they provide in that particular case? Is that different than the flu?
No, it would be quite similar.
Because it's a virus, and we were actually looking a little bit more information because we're getting new information all the time. It's such a new disease to us as a world. There is no treatment for the virus at this point in time. It's treating the symptoms and it's caring for people. So if you have a fever, it's helping address your fever with whatever you might take. If you have respiratory issues, it's helping address those respiratory issues with whatever you might take.
So we have obviously heard a lot about face masks, and everybody should have them. So, of course, my favorite scene last night on the news was, I think it was in Seoul. There was literally a line that looked like it was miles long. I'm thinking they're all communicable to each other in this particular setup, but they're all trying to get face masks. What do face masks work? Do we know if they work with this particular virus? And is it worth that precaution? I know that 3M is now in the Midwest in triple production and all that. Do they work?
They help. It's part of universal precautions. It helps with droplet protection if you have the right type of face mask. Do you want to speak to, some people you'll see wear surgical versus N95s. Can you speak to that?
So there are different types of face masks that are designed to do different things. Like if we were working a tuberculosis case and say Kathleen had tuberculosis and I was caring for her, she would wear a mask that's designed to prevent droplets from being released.
Expelled, okay.
I would wear one that's designed to prevent them from being taken in. But the reality is at this point there just aren't people walking around in the United States with coronavirus, so to wear a mask at this point just isn't warranted, even with the flu.
Do people call your office and say, listen, I'm traveling to wherever, and what precautions I take? Is that information your office provides? Do you get many calls on that when somebody's traveling, whether it's within the United States or abroad?
We do get calls from people. It's amazing the variety of calls
I'm sure.
that we might get. It's fascinating, right? It keeps the job interesting. We can speak to what we know in our county. We can speak to what we're given within our state, but we might refer people to check the Department of State. A lot of times we might
Centers
get
for Disease Control.
in the Centers for Disease Control, and they'll identify. Department of State, for instance, has a lot on the particular country that you might go to, and they may then make links to the WHO or to the CDC for health-related issues. But also, we have the ability to speak to people a little bit about types of vaccines that they should consider before they travel, but we don't provide what's called a travel clinic. That's only in certain counties. It's usually greater population counties where they might provide some vaccines that are to your best interest to have before you travel to certain countries.
And so you should look on the web and look to government sites to tell you what is available out there.
And we're happy to help.
And you mentioned a few minutes ago, is this information evolving so quickly, and there's so much disinformation out there? Is it how tough is it to keep up with what's going on this particular on the coronavirus?
You really want to go to a credible resource, and how do you identify that credible resource? You go to what we know has been the gold standards. In our case, we know that our Centers for Disease Control and Prevention is very stringent and very particular about how they present information. We know that our New York State Department of Health then will often emulate a lot of the information and then add specific state information to us. So that's what we put on our website for the Cayuga County Health Department. We'll put links to those credible sites. The World Health Organization is a credible site. There are other sites such as the Academy of what's our immunization one? The pediatric.
American Academy of
Pediatrics that provide information. So you go to very reputable organizations.
And you mentioned influenza A and B. First of all, what is A and what is B?
Okay, so there are different genetic strains of the flu, and in a typical year, you would generally see A spike first, and then maybe after the new year, you would see B catch up and surpass A. This year, I think, has been atypical in that B came on fairly early as well, and they've been neck and neck the whole season.
And do you see a lot of deaths result from that?
About equivalent, the two. In an average year in the United States, we might have 23,000 deaths from the flu. It is the number 8 cause of death in the United States.
But we're nowhere near. This is the 101st, 102nd anniversary of the great influenza in 1819. We're not at those proportional numbers.
We're overdue.
No. We're overdue. Why do you say that?
Because it seems.
Because I think that was one of the great books I've read in the last 2 years. Has been the Great Influenza. I thought it was a great book and worrisome as well.
Yes.
Once in a century, we're supposed to see something of those proportions.
And you just think we're overdue.
Yeah,
You're not a fatalist.
102 years.
You just think it's the cyclical time.
Yeah.
How do we prevent that?
Well, part of what we do in public health is prepare for eventualities such as this. We do practice exercises where we see what it would be like to draw together the resources to treat a county of 80,000 people with a vaccine or pills. And you want to speak to the pod exercises that we do?
Sure. So we have preparedness. We do receive some funding to help execute that, and there are certain tasks we must do. The past few years we've had, we call it a point of distribution, where we, exactly as Kevin said, we get our staff and other employees work a clinic to be able to bring people in, send them through within a certain time period, make sure they get the appropriate medication or the appropriate shot. And we've done actual flu clinics where we will provide the vaccine to have real life practice. But we've also done drill and just pretend ones where we might pass out
Right.
M&Ms as a drug. There's a lot to it, right? Preparedness is not just giving you the medication, but it's how do we get the medication? How do we get it to the sites that need the medication?
What's the infrastructure there?
We can always use more,
Okay.
but we do have plans that how do we receive information? How do we receive the medications? Who our partners are to help us deliver those medications? Agreements for partners to also help us in delivering those medications.
And I don't want to get bogged down in the flu and coronavirus, but just if someone wants to get the flu shot, where can they go? I know your office.
So the Cayuga County Health Department does offer that, and people can call our phone number at 315-253-1560 and schedule an appointment.
We'll give that out again before we end. So.
And we're always pleased. But fortunately, like the flu vaccine, you can go to your healthcare provider, and they often offer it, or pharmacies will often offer that, and that's wonderful.
Wegmans, they'll take care of it.
There are, you might go. You can shop around and really get the best buy in what your insurance provides. Also,
How much does it usually cost for a shot?
it's $35 for us, and some places might do it for $29. Some people might take your insurance. Some people say pay cash.
Will you take insurance?
Yes.
You do. So the other item we talked about the leaders show is the issue of the spread of hepatitis A. First of all, what is it?
So there are several viruses that attack the liver and cause inflammation of the liver, hepatitis. Ones that we most commonly deal with at the health department are types A, B, and C. And B and C are the bloodborne ones that people might get either through a sexual infection or from shearing needles from intravenous drug use. The most common ways we see C and B spread. Hepatitis A is spread by what we call the oral fecal route, where it's shed in somebody's feces, and if they don't wash their hands well enough after using the bathroom, they can then touch other things, prepare food, spread it on to other people.
And so there is an uptick nationally and within New York State?
Correct, and within Cayuga County, actually. So that's one of our factors that we want to share, is to encourage people not only to be aware of what hepatitis A is and how it's spread and how to help prevent it, but to be cognizant if they ever think they might have been exposed, and to look for signs and symptoms.
So what are the signs and symptoms?
So you want to look for gastrointestinal symptoms. People might have nausea or vomiting or diarrhea, abdominal pain. One of the telltale signs that we see is jaundice. The yellowing of the eyes and of the skin is pretty remarkable.
So that's
in
for
these
A, B,
cases.
and C.
For
the
A, B, and C,
Okay.
correct.
And so if someone feels that they may have been exposed to hepatitis B, is it curable?
You will get healthy.
You will get
to
healthy.
say there's a treatment is tricky. I'll let Kevin speak to that a little
Okay.
more
So
clearly.
for hepatitis A, the one we're focusing on, that one, it's kind of like how we talked about with the flu. You're sort of providing supportive care, and that one generally runs its course within a matter of weeks or months, unless
But are
somebody,
you treated with medicines or?
there's no specific treatment for that virus. It runs its course.
So what's the benefit of getting it? I know there's a benefit of identifying it so that you don't spread it, but is there any other benefit from identifying it as well?
One of our biggest priorities, the first thing we do when we see somebody comes up in our system is having a positive hepatitis A test, is to say, what do they do for a living? Do they work in the food services? Do they work in healthcare? Do they work in daycare? Because if a random person off the street has hepatitis A, that's not the threat we're worried about. We've had a dozen cases in the last 3 months, and almost all of them have been unemployed, fortunately. But it only takes one in the food services to work one day when they're sick.
So are you surprised that they're unemployed and they have not been involved in the food service or medical?
Well, so we're glad, but there's
I know
other.
you're glad, but are you surprised? That's a different
not
issue.
glad that someone's unemployed, certainly, if they
No,
wish
I
not to be, as you know.
But normally
it's
you
not
would find these cases in those other daycare, food service.
Those are the ones that you might hear about most when there's
Okay.
an outbreak.
Okay.
Because that's the easiest way to spread it to a large population, is to work in one
Okay.
of those settings. There's a lot of risk factors that we're seeing attributed with hepatitis A outbreaks, which may be contributing factors at times for the cases that we've seen. Do you want to speak to some of the high risk?
Yeah.
areas?
So our biggest concern, again, food service, healthcare, daycare, but it's not that they're at highest risk. Highest risk are people who have a history of homelessness, incarceration, drug use, people who utilize public STI clinics, men who have sex with men, and people who work closely with those groups. Almost every case we've seen in Cayuga County so far, there's a history of at least substance abuse, if not homelessness and incarceration.
So once it's identified, what is the course? What is the physician or you as public health officers telling that person to do?
Encourage isolation, and if they are employed, not to go to work. And one of the biggest things that we do is a contact investigation. We want to know everybody that they've been exposed to in a close factor in the previous 50 days. And anybody who has been exposed within the last 2 weeks is actually recommended to get the hepatitis A vaccine, which can help protect them from becoming infected as well as protect them moving forward. And certain groups like children under 12 months of age, anybody who has a suppressed immune system would also get antibody injection to help protect them as
So
well.
is there a vaccine against this?
There is a vaccine.
Is
and
that a normal course of action that everybody gets it?
It's not, and you bring up a good point. My children thought they might have had it, and I go, well, I know they had a hepatitis shot. Most people may not realize whether they did, and they should look it up. Their doctor's office may have it. The health department may be able to access that information for them if it's in our state immunization system. You can there's a 2-series shot for hepatitis A. Children get hepatitis B, but they don't necessarily get hepatitis A. Adults probably don't have it unless they work in a certain field where they thought they should have gotten it.
And you said, I thought I read somewhere that you said there was a 4-fold increase over the last 4 years. Any reason?
Correct.
Do we know why?
All of these reasons. Probably a lot of needle sharing use and behaviors
So
that
somewhat linked to the
have increased.
heroin and.
No question.
Okay. We've got a couple minutes left. I know you have a whole long list of things that we were going to talk about. What's HPV for those who don't know? Because I just listened to Pandora this morning as I was shaving, and there's an ad. Get a shot. So
Good.
what's HPV?
It stands for human papillomavirus, of which there's over 100 different strains, but there are a handful that are transmitted sexually and by skin-to-skin contact that are capable of causing cancers and warts in people. And those cancers cause tens of thousands of deaths in the country every year, and they're preventable through a vaccine. It's only 2 shots if you get them before you're 15, 3 shots if you start afterwards, but highly effective in stopping the progress of these viruses.
So do most adults, I know there's been some issue about that, and we'll get to that in a second, but do most adults if I go to Dr. Green, who happens to be my doctor, if I go in there and I asked him today, did I get the HPV, what would he likely tell me?
Unlikely, because it's a relatively, about 20 years.
Yeah, the vaccine you're
The
saying.
Aging
vaccine's
me.
been around. Well, so
And by the way, I know how old you are,
I know
too.
you
so
do. So I was not eligible either at the time
so
frame.
would you
that
only get
yes.
it until you're in your is there a cutoff time? So I wouldn't go in there today to Dr. Gray and say, not that I'm giving him an ad, but I would not go in there and say I want an HPV shot today.
No, but the eligibility has broadened.
Yep.
So what's the range?
So it's recommended that people start at 11 or 12 years of age. That is when they have the best immune response, and for most before they become exposed to the virus. So that's
Okay.
why that would be ideal.
Okay.
It was up until recently recommended for people up to the age of 27, recently expanded now up through the age of 46.
And there was an issue within the last couple of years. Should it just be girls, or should it be girls and boys? So what first of all, what was the issue?
Originally, it was associated with cervical cancer, and when the vaccine first came out, it was targeted exclusively to girls. Then, for a number of reasons, it was switched more and more to boys. We realized that they were susceptible too, and that having them be unable to spread the disease did as much for public health as protecting the girls individually. Now that we see the numbers, it actually seems to be a bigger problem for boys than it is for girls. Head and neck cancers in men caused by HPV has surpassed cervical cancer from HPV in women.
So the 3 sheets that you sent me, the only thing that is capped in caps here is sex can cause cancer. So you didn't think I wasn't going to ask you that one? So talk to me.
So there are actually 2 different diseases that can cause cancer. They're viruses. We talked about hepatitis B a little bit earlier. That's one that can potentially cause cancer, and the HPV. And that's kind of a scary thing, that cancer can be caused by an infectious disease, but the great news is that both of those do have vaccines that are very effective in preventing the spread of hepatitis B and human papillomavirus.
And so is the HPV, the series of shots, is that offered by the health department?
It is offered by the health
And
department.
your phone number is, again?
315-253-1560.
But they should, somebody, a parent, or because it's likely going to be a parent, should be having this conversation with their health care provider.
That is the ideal situation, yes. But we certainly know sometimes there are young people who say, maybe I'm not comfortable talking to my parent, but I want to talk to someone else, to my health care provider, to a nurse that I work with.
Do we have any idea how many, whether it's local, state, or nationally, as a percentage, how many people, young people in that age group are getting this?
One of the things the health department does is review the statistics of the local providers, and we are roughly around the 50% mark of kids who are eligible for the vaccine who have actually started and made it through the series.
And so that's local. What do we have a national number?
It's about national as
That's
well.
Are you surprised it's at 50%?
I'm pleased it's at 50%. We'd
That's
like to see
Because
it
there's
higher.
a lot of talk about it that's not very positive.
I think some people associate it solely with sex, and there are a lot of moral issues
Qualms
that
about
people
that.
bring
Okay.
to the table with that. And it's good to have your values and share that with your family, but it's good to prevent disease also,
Which is your job.
which is our job, and we're really pleased. We'd like to see the numbers get higher, and that's what we're here for.
Okay. Well, I do want to thank both of you, Cayuga County Health Department Public Health Director Kathleen Cuddy, as well as Supervising Nurse Kevin Zippel, have been here to talk about communicable diseases. We didn't get to everything. We most likely will have you back to have that conversation as well. But we've been talking about hepatitis A, the coronavirus, the flu, as well as HPV. We do encourage you to talk to your health care provider. Again, if you want to contact the county, you can call them at
315-253-1560.
And Mr. Cuddy will be back in a couple weeks. We'll be talking about the WIC program, Women and Children and Infants. We'll also be having some conversations about vaping and smoking, because if you may remember our November show, I was somewhat stunned at the number of smokers still in the United States after the Surgeon General's report of more than 50 years ago. We'll also be doing a show on lead. So we want to thank you both for your time. We'd like to have you in the studio. We will be back on Thursday with a Beyond the Front Page. I will not, for the first time, be hosting that particular one. I'll be out of town. But Bob Frame will be in the studio, our director of theater programs here. He's going to have Melody Brooks, who is putting on 2 plays this weekend, both on Friday and Saturday, in the Bisgrove Theater here at the college on the suffragette and women's movement. And he'll be here on Thursday to talk to her about that as well. We'll be back next week and starting next week, a series of conversations with the candidates for Congress who are looking to take on Congressman Capco. We have Dana Balter, Mr. Misso, and Mr. Canola, who've all agreed to time here. We have also offered that same time slot or a similar time slot to Congressman Catco to have that conversation. We'll also be having conversations about bail reform as well as the public health conversations we'll have. And then we'll be back with a series of forums also in April, which will include the candidates for the 50th Senate District. That's a special election. The candidates for the 24th Congressional District, and of course the Auburn School District as well. I'm Guy Cosentino for Cayuga Community College. We want to thank you for watching. We hope you have a good evening, have a great tomorrow. There will be somebody back here in the studio on Thursday. Otherwise, I will see you back here next Tuesday with Inside Government and Beyond the Front Page. Have a good night. Have a good weekend.